This presentation examines air emissions from the operations of the gas industry in Queensland's Western Downs region. It covers emissions from oil and gas extraction, gas compression, gas supply pipelines, and gas-powered electricity generation. Air pollution from coal mining and coal-fired power generation is not included, and the available statistics don't distinguish between oil and gas production activities. The Western Downs region extends westwards from Dalby, which is just over 200 kilometres from Brisbane. The air pollution information has been obtained from the Commonwealth Department of the Environment's National Pollutant Inventory, which requires polluting industries to self-report emissions of 93 toxic substances. The NPI information is available to the public and can be searched and analysed to show emissions from within any desired geographical region within Australia. The NPI does not include emissions associated with gas exploration, coal seam gas related emissions of a substance of less than 10 tonnes per year, the release of greenhouse gases such as carbon dioxide and methane, and the enhanced diffusion of gas from soils due to changes in subsurface strata caused, for example, by horizontal drilling and fracking. As the table shows, the gas industry operating in the Western Downs region is predominantly overseas owned. The highlighted information shows that in fact Australian participation is limited to a minority share in 2 projects. This slide shows the location of the industry's facilities throughout the Western Downs region. The Surat Basin coal seam gas facilities are shown in green. The industry's facilities include numerous and growing numbers of gas wells. Field compressor stations send the gas to centralised gas processing plants for processing to remove water and impurities. Several field compressor stations are needed to supply a central processing plant. Water treatment plants receive coal seam gas wastewater piped from storage ponds for treatment. Compressor stations further compress the gas for transportation through high-pressure pipelines, and power stations use gas for electricity production. To what extent is the health of the Western Downs population, the food chain, animals, and the environment affected by the industry's emissions? Firstly, the population numbers around 32,800 people. Vulnerable groups within this population include the young, about 23%, and older people, about 13.6%. People with pre-existing health conditions such as asthma are also vulnerable, as are industry employees and contractors. Emissions from the industry have grown strongly since it commenced. In the last 10 years, emissions of sulphur dioxide, for example, have grown from almost zero to 14.3 thousand tonnes in 2013-14. Oxides of nitrogen emissions have grown from almost zero to 17.3 thousand tonnes in 2013-14. This table shows actual tonnages of all self-reported National Pollutant Inventory air emissions by the Western Downs region gas industry from 2003-4 through to 2013-14. The substances in coloured lines were shown in the previous chart. Aggregate annual tonnages, as shown on this table, do not accurately indicate the levels of atmospheric toxicity Because some substances are very toxic in small volumes, such as particulate matter, 2.5 microns or less, and formaldehyde. Also, the altered toxic effect of different emissions combining in the atmosphere is not known. 96% of the overall Western Downs gas industry's pollutants are emitted within 55 kilometres of Hopeland. Air emissions from within 55 kilometres of Hopeland during 2013-14 accounted for 90% of oil and gas extraction emissions across the Western Downs region, 83% of total gas supply emissions, and 100% of gas-powered electricity generation emissions. In fact, 96% of all emissions came from within 55 kilometres of Hopeland. What are the toxic effects of some of these pollutants? Low levels of exposure to oxides of nitrogen can affect the eyes and respiratory systems of both humans and animals. High levels of exposure can bring serious respiratory consequences. Oxides of nitrogen can also damage farm crops, increase water and soil acidity, and disrupt biological systems. Exposure to sulfur dioxide can affect the eyes, skin, respiratory system, and the heart. Those with impaired heart or lung function, including asthmatics, are at increased risk. It can also affect the reproductive systems of animals and is a major component of acid rain, affecting crops and water quality. Even low concentrations of sulfur dioxide can combine with other chemicals to form acid rain and particulate pollution, affecting crops, plants generally, land, water, and ecosystems. Carbon monoxide can affect the body's ability to carry oxygen, causing headaches, fatigue, mental confusion, and breathing difficulties. Long-term low levels of exposure can cause heart disease, damage to the nervous system, low birth weight, and birth defects. Carbon monoxide can also threaten the health of animals and their offspring. When exposed to long-term low levels, pregnant animals may experience low birth rates and nerve damage to offspring. It also promotes climate change. Particulate matter is carried through the air, and its size and existing weather conditions determine where it falls to the ground. Smaller particles can enter the lungs more easily. Particulate matter affects the heart and respiratory systems, especially of children and the elderly, causing respiratory diseases including lung cancer. Animals are similarly affected. There is no evidence of a safe level of exposure. Volatile organic compounds are toxic and can cause eye, nose and throat irritations, headaches, memory loss, damage to the kidneys, liver and the nervous system. Some VOCs are carcinogenic. VOCs can also damage animal and plant health. Formaldehyde is a known human carcinogen, typically associated with leukemia and endocrine system and hormone disruption. Greenhouse gas emissions are not reported in the National Pollutant Inventory, and so are not shown in the earlier figures. They can be toxic and invisible and contribute to climate change. The Australian Greenhouse Gas Emissions Information System records carbon dioxide, methane and nitrous oxide greenhouse pollutants, but does not publish records of these gases in a way that allows regional emissions to be identified in the same way as the National Pollutant Inventory does. As an overall indicator, Queensland fugitive emissions from fuels have grown by 400% from 3 to 12 million tonnes over the last 23 years. Apart from their obvious and serious climate change impact, the three measured greenhouse gases, carbon dioxide, methane and nitrous oxide, are required to be present in relatively large quantities to produce toxic effects. The Queensland Government's air monitoring network provides access to online real-time recordings of a limited number of atmospheric pollutants. It does not publish any statistics for the gas-filled areas of the Western Downs. As the graph shows, the gas industry is expected to expand significantly, at least over the next 15 years. It is reasonable to expect that air emissions will also grow substantially over this period. The region has only been exposed to the gas industry pollutants for a relatively short time, and so the cumulative effects of ongoing and increasing exposures are not clear. After a period of high initial output, well yields tend to fall away depending on the productivity of different areas. So just to maintain production levels, many more gas wells need to be drilled. As gas wells deplete, you have to keep drilling and drilling just to keep production in the same place. Can we be confident that air emissions are being managed appropriately? The Queensland Government has adopted a regulatory strategy of adaptive environmental management. In large measure, regulatory responsibility is delegated to the industry, which is relied upon to operate in good faith, disclosing adverse outcomes, trusting that any consequences are not serious and can be managed or made good. It has been described as learning by doing. Others have described the process as closing the stable door after the horse has bolted, or suck it and see. Is adaptive management working? A 2013 health survey of 113 Tara residents by Dr. Geraldine McCarran found that over 80% reported that their health had been adversely affected and a further 19% were uncertain. Those affected experienced a wide range of symptoms: coughs, chest tightness, rashes, difficulty sleeping, joint pains, muscle pains and spasms, nausea, fatigue, numbness and paresthesia, headaches, twitching or unusual movements, and clumsiness or unsteadiness. QGC purchased the properties of several families experiencing health issues on the condition that they were legally gagged from discussing the issue. Dr. McCarran's research called for 1. A fully funded comprehensive medical assessment of residents. 2. An urgent implementation of fully funded, long-term epidemiological studies to track the health of people. 3. A requirement that health impact assessments are an integral part of unconventional gas development proposals. 4. Independent, unbiased, fully funded, comprehensive, publicly available, real-time air and water monitoring. And 5, full disclosure of all chemicals used by gas companies. However, the recommendations do not appear to have been considered worthy of implementation, and the public has not been made aware of any government-initiated human, animal or environmental welfare strategies. The Queensland Health response to Dr. McCarran's research has been described as an exercise in minimisation and misrepresentation. Some of the report's recommendations are shown on this slide. Communities are still waiting to see initiatives implemented that were recommended. A less deceptive way of describing flaring is that it releases toxic substances into the air, injurious to human and environmental health. The precautionary principle requires that an action should not be taken if the consequences are uncertain and potentially dangerous. New South Wales courts have now applied the precautionary principle to refuse mining operations, setting limits on the use of adaptive management so that it cannot be used to overcome deficiencies in environmental assessments, particularly in situations where impacts can be irreversible. The planned rapid increase in CSG wells will bring more toxic air emissions into the foreseeable future, potentially affecting people, animals and the environment, and potentially entering the locally produced food chain. Are air pollution threats being adequately addressed? People concerned about exposure to CSG health risks should consult a trusted doctor. An online report by Dr. Wayne Somerville contains self-help risk management tools which could also help people better protect their families from the health impacts of unconventional gas mining.